Doctors have warned wait lists for elective surgeries have risen to record levels, leaving 1 in 50 Australians facing a backlog. Research from the Australian Medical Association shows 500,000 patients could be facing a delay by mid-2023 after operations were paused during the pandemic. The number of surgeries performed nationally has fallen to its lowest levels in a decade, and the number of patients admitted for elective procedures has dropped by more than 130,000. Australian Medical Association President Steve Robson is calling for urgent action from the federal government.
There are a series of system problems at the moment. Our hospitals are in logjam at the moment, and it's extremely difficult to get the resources, the beds, the nurses, the doctors, all the resources in a hospital needed for surgery, and things are getting worse by the day. We need a national coordinated action plan now.
For more on this, I'm joined by Shadow Minister for Health and Aged Care, Anne Rushton. Thanks so much for joining us, Anne. The Australian Medical Association says 1 in 50 Australians on this backlog list for public hospitals, and that could explode out to 500,000 patients by the middle of just this year. Firstly, what do you make of that assessment?
Well, look, sadly, I don't think any of us should be surprised at the AMA's report today about this explosion in elective surgery backlogs. I mean, we've known for some time the impacts of COVID because of deferred care. You know, people haven't been doing screening, they haven't been doing testing. Elective surgery was put on hold because our hospital systems were responding to COVID. So sadly, it should come as no surprise that we have a real challenge making sure that we catch up on everything that was put aside during the COVID pandemic, necessarily so. But we've known for some time that this was coming to us, and I think Steve Robson's absolutely right. We need a plan. I've been calling for this since I became the Shadow Minister for Health, and I really do think that, you know, Australians deserve a plan to deal with this fallout, which inevitably was going to happen after COVID.
Well, you say necessarily so. Elective surgery was shut down, but knowing what we know now, are you certain that the cancellation of elective surgeries during the COVID pandemic was the right decision?
Well, obviously everything that was decided and decisions that were made during the pandemic were based on the best medical advice that was available at the time. I mean, obviously, you know, the benefit of hindsight, you know, there's some things that may have been done differently, but I think overall Australia's record, you know, saving, you know, many tens of thousands of lives, having a strong economy coming through the pandemic, you know, being the envy of the rest of the world, you know, certainly said that we did a lot right through the pandemic. But, you know, unfortunately now there are some fallouts from that time. And the report from the AMA today, I think, just highlights what many of us have been saying, and the AMA, for that matter, have been saying for some time, is that we need a plan to guide our way out of what has been a lot of deferred care that has gone on over the last 3 years.
The biggest problem is not enough people. That is what we're hearing from the medical institutions and the hospitals. And how is throwing billions of dollars going to help the problem if the problem is just a shortage of people?
Well, look, certainly there is absolutely no doubt that workforce shortages right across the care sector, that's healthcare, disability care, aged care, are really, really impacting on the outcomes of those sectors for Australians. But, you know, we had a job summit back in September. We haven't really seen much from that. We've had urgent care clinics promised by this government. They were promised to be up and running by the middle of May this year. At this stage, we don't even know where they're going to be located. I think there's a lot of things this government could be doing to try and start putting real and practical measures in place to alleviate some of these concerns. But, you know, so far we've seen a lot of admiration of this problem, but we need real and practical solutions that are actually delivering outcomes and helping start the process of addressing the challenges that are clearly before our health sector at the moment.
The $750 million promised by the Albanese government to help fix Medicare, is that enough? Health Minister Mark Butler says it's not something we can fix in one budget. What do you make of his comments on Medicare?
Well, there are a lot of challenges facing the healthcare sector at the moment. Many of them are underpinned by that issue of workforce shortages. And of course, you know, there are going to be there's no silver bullet to solving this problem. You know, COVID has exacerbated, you know, challenges that were before the health sector even before COVID. So I think, you know, we do need to address this in a systematic and responsible way. We need to do it at all levels of government. It's not just a federal government problem. Our states and territories need to be on board with addressing the issues. But, you know, so far I have been really concerned that we've had a lot of talk about what we're going to do and a lot of talk about the problems, but we really haven't seen any tangible solutions or even any small measures put on the ground that are actually going to start addressing these concerns that are constantly being raised by people like the AMA, the RACGP about shortages in GPs, you know, the shortage in registered nurses that are challenging our aged care workforce. There seems to be a lot of talk about the problems, not so much talk about the solutions.
Okay, Anne Ruston, really appreciate your time this afternoon. Thank you.
Thanks, Kenny.